Healthcare systems are going to change more radically over the next few years than any of us have seen in our lifetime. And there's two drivers of change. The first is the use of artificial intelligence, where machines, black boxes, are actually interpreting a myriad of data to provide diagnosis for patients. And the second one is the whole genome sequencing work that's underway that allows healthcare professionals to diagnose using prediction and prevention methodology rather than perhaps waiting for symptoms to arrive. So we could look at somebody's risk of developing breast cancer or indeed other conditions by simply sequencing their genome and then make sure that we're very much working to predict their disease and prevent their disease rather than what would have happened in years gone by, which is diagnosing and treatment.
And what do you think could happen if Gibraltar didn't make moves now?
So it's about Gibraltar being on the front foot, that countries around the world are faced with the same issues and challenges, but Gibraltar is perfectly positioned with the technology that's here, with the expertise that's here, and yet in a relatively small healthcare environment to be able to really leapfrog some other countries around the world and be very much at the forefront of this.
How difficult to do that now when the health services are coming out of COVID?
So there's never a right time. Every healthcare system is challenged by not only the tremendous efforts that people have put into dealing with the COVID pandemic, but also by the thousands and thousands of patient appointments that didn't take place over effectively an 18-month period. So yes, it is a challenging time, but you know what? We also learned during COVID that some things can be done using technology, some things can be better done in ways that perhaps we didn't do them before. So it's around blending the use of video conferencing technology, for example, to see patients in one instance. If people don't need to travel abroad for a specialist opinion, then let's look at doing that. So building on the learning from COVID and also bringing in the new technology that we now know exists will allow us to recover from COVID probably more quickly than if we just try and return to what we had before.
Well, Gibraltar's size works against its health services in that perhaps doctors don't see enough of one particular disease or ailment. But do you think that, on the other hand, its size could be beneficial in that we can turn things around quickly?
Yes, absolutely. So, of course, it's both. And one of the things that we're very keen to do is to further develop twinning relationships between specialist centres in the UK, where that makes sense, and Gibraltar, so that specialist expertise can be shared, but also to make sure that all those core services are robust here in Gibraltar. So, yes, it is two sides. You're small enough to be nimble, but also where specialist advice is needed, it can be called on from friends and colleagues in the UK.